Thank you. I'm Markus from BuddyCare Finland, and we are at BuddyCare doing mobile care coordination platform for hospitals and their patients. And our mission is to make care accessible, actionable, and measurable for the patients and for hospitals and hospital admins. Every one of you in this room knows that the challenges of hospitals to guide the patients to the hospital, to treatment and back to home. It's really paper-based till 2019. Taxation has been digitalized in Finland already 10 years ago, but the patient's care is still paper-based forms, phone calls, etc. And this leads to stressed patients, maybe uncertainty of next steps, and this might lead to cancellations and no-shows. And of course, this requires lots of admin work from nurses to print out papers, checking forms, and calling to patients. And also, this kind of care is difficult to develop further because you don't have the data, you don't have outcomes, you don't have experience metrics from the patient. So it's very difficult to collect this data because it happens through the phone call and through the paper forms. What is the solution for this one? It's a care coordination platform for hospitals and for patients. We make care accessible. When patient has an indication or any treatment needed, he or she will download the app and they have all care-related information in the very easy-to-use mobile application. All questionnaires, reminders to nutrition, medication, etc. in a very easy-to-use mobile application. And after the visit to hospital, leaving from the hospital, information on how to take care of the wound, rehabilitation programs, outcomes, etc. Actionable for healthcare professionals. The dashboard follows all the steps what the patient has taken in the care process. And if there is some care deviation, the platform will arise attention to doctors and nurses. So you only react when there is a patient with the need of extra help. With the cooperative patient, you don't need to spend any time with them. And in our experience, over 4,000 patients, 90% of patients who are digital is compliant with the care all the time. And of course, for admin, we bring all the data. It's real time, all the time, can be reported. Outcomes, experience metrics, user metrics from the application, reasons for cancellations, etc. We are providing this as a white label solution also for customers. They can have a fully white label solution, apps and dashboard with their own names and logos and fonts. And then some results of, from real life. Helsinki University Outpatient Clinic, surgery clinic, has used our application since beginning, and they have been able to reduce no-show rates by 50% and phone calls by 80%, and mainly because of better informed parents, what to do next, where to be, and with the checklist and all. And Tampere University ENT Outpatient Clinic digitalized the whole clinic, all patients group. And they invited everybody from child to elderly as a digital patient. And over 85% of patients wanted to have digital approach instead of paper-based and phone call version. And from them, they were able to reduce phone calls almost 100%. And they saved 80 minutes time per patient in pre-op phase. So nurses, they didn't need to check the status of patient because the platform does it automatically. So here is the example of the care process before, down here. The first bullet point is a GP visit, and the third one is the referral checked by the hospital. And previous one, they sent a mail, normal mail. Now the Finnish post office went to strike, and there are going to be strike in 1 month, and now the whole healthcare system is waving hands, and oh my God, where is the phone centers? Because everything is worked by the paper. Then they had 2 phone calls before the operation and then 1 follow-up call. And now when they are inviting patient as a digital, the patient started to have, will fill the pre-questionnaire and have all the information before the operation, and the follow-up is also in digital form. So no contacts to patient before and after the operation. So they were able to reduce cost by over 60 euros. In easy-to-use outpatient ENT surgeries. Benefits for the patient, you have your data all the time, 24/7, offline, online, on your phone. You have timely instructions what to do. Please stop anticoagulants. And things like that. And of course, you can share the care pathway with your wife or other person who supports you in your care. For doctors and nurses, reduce admin work, phone calls, mailing, post, and reduce cancellations and automate some of the follow-ups also. And for hospital management, easy platform to collect data, outcomes, metrics, other quality of life questionnaires. How we are unique? There are several platforms in the markets, and we are doing modular platform, so we can create any kind of care processes, from operative to psychiatry to internal medicine to chronic care. So hospitals, they don't need to deploy different kind of applications and softwares. We can configure any kind of care process to our dashboard, and we are already working with 14 different medical specialties. The dashboard is really process-driven. It tracks everything the patient has done, and you have one view of your department patients, and we highlight attentions if there is deviation from the care plan. With the cooperative patients, you don't need to do any actions. App for the patient is also process for the patient, horizontal process, and it's fully transparent. You can see from day one what is your whole process to the end of recovery. And patients really love this, that they know already since day one what they need to do in a whole care process. Our business model is direct sales, of course. We are very active in Finland and in Germany. And this SaaS service per medical specialty, like orthopedics, ENTs, they have their own licensing fee. And we are currently working with over 60% of Finnish public hospitals and 3 university hospitals in Germany. And then we have licensing agreements with 2 German-based medical device companies, Karl Storz and Heraus Medical. And now we have contracts with Boston Scientific to target some customer cardiology clinic here in the UK. And then we are working with the DigiHealth. We are growing fast in Finland, of course. We are a Finnish company, and we have a framework agreement with most of the hospitals. And now we have a contract with 3 university hospitals in Germany, and we want to expand our presence in German markets. So the platform is already alive. It's HIPAA GDPR compliant, and it's CE marked. And this year turnover will be around 600,000. We will double it for next year and grow even faster after that. And now we are looking for funding to expand our sales force to German markets, to Nordics, and of course develop the system even more automatic and better. Our team is very good combination of software and business development and medical device sales professionals. And we have an in-house development team located in Helsinki. So the whole platform is our own one, started from the scratch, and we have our own development team. Thank you.